It's actually really overwhelming to be here and looking at you from this side. I think at the beginning of the meeting I just couldn't talk because it's really, really impressive. Thank you so much all for coming today. I'm going to be brief because I know that you've been listening for a long time now. I'm going to give you some information about how you can get involved in research. When I say to get involved in research, it's not just about to participate in a clinical trial, but also from getting involved from early stages of the development of the clinical trial. That involvement includes the participation, of course, and also being some responsibility and accountability in the process. In this talk, we will also talk about your concerns about participating in a clinical trial. And I'm going to explain you the active clinical trials that we have now open in the neuroendocrine unit at the Royal Free Hospital. And first, I'm going to explain one clinical trial that Lorraine has already talked about that, and also Professor Kaplan, which is now in the process of changing management thanks to the results of that study. And I would say that clinical trials are today the way of how treatments are improved in the NHS, by giving the possibility of treatments that might not be available in the whole UK. So your help is definitely needed. Okay. There was one study called Clarinet, which was closed like a couple of years ago after completion, with patients who were non-functioning, mostly pancreatic, but also including all possible neuroendocrine patients. And they were randomized to either having the active compound of lanreotide autogel or to have the placebo but best supportive care. What's the case of Lorraine in this study. This now, after nearly 3 years of recruiting data, now this study is going to be published on Wednesday, Professor Kaplan said, and it has shown that patients who are on the active compound maintain stability of the condition for much longer than patients on placebo. So before this trial was conducted, it wasn't the normal practice to put patients on somatostatin analogs because they didn't have any symptoms. So what was the purpose of it? But now it's been found that this medication has actually anti-tumor effect on its own right. The process of involvement, it's empowering yourself into deciding what are the health outcomes that you're actually interested in. When you're participating in a clinical trial, all that is done for you. It's about symptom control, it's about your carcinoid diarrhea, it's about quality of life, it's about tumor control. But there are you together as a group could decide, could influence the industry, could influence the governance, in order to decide from yourselves what is important to you. And you could do that as a group better than if you do it in isolation as an individual. In order to provide the best, highest quality of research possible, because it's not just about the industry marketing a medication, it's in order to evaluate what are your concerns to be evaluated in the group as a whole. You could also become research ambassadors, which is a pilot initiative with links. One key person from a patient group or from the public or a carer links with the London Cancer Research Networks, which are in contact with the industry and with the researchers in order to decide which projects are actually the funding to go for. So in here there is an opportunity from a pilot initiative to get involved and to have your say. And then another program, which is from the National Institute of Health Research, which is called Involve, is actually a body where it connects patients, carers, and the public with the industry and with the researchers, and they act as a link in order to put your voice all together. So in order to have like discussions about what is the research that you actually are interested in. Yeah, participation is also one of the key things in a clinical trial. Without your participation, it's impossible to conduct them. But in order to participate in a clinical trial, you need to make an informed decision. In order to do that, we need to remove all the barriers. From our point of view, from the healthcare professional setting, we need to eliminate, we have to provide you with all possible information in order for you to decide. But you also need to consider what is expected from you, how much of you is going to ask the trial. And you need to discuss that with your family, with your friends, with yourselves, and you need to have time to decide. Then you need to be able to evaluate the evidence on which your case is based on. What it means from this is like, why the clinical trial and not before? Why I am not going to have another treatment instead of the trial? Why, if the trial was open a year ago, you're offering to me now? This is the kind of things that we would like you to know exactly why this is the time that we are offering to you and not before, for you to understand exactly the process of your care. And then, when you are participating on a clinical trial, we would like you to express your experience with us, with other patients, disseminate that word, even if it's, especially if it's good, and if it's bad as well, you can let us know, and to recommend it to others or to share about the experience. I know as a fact that there is a clinical trial where one of our patients, she was so positive into going because she discussed this with one patient who was already on that clinical trial. But I'm not going to say names. Then you should expect clarity of the information that we are providing. And you need to be reassured of the safeguardings in systems in place in order to maintain the safety of the clinical trial and yourself. Sorry, not the clinical trial, but yourself, sorry. This is actually the major concern, my safety, when I participate in a clinical trial. You're giving me an experimental medication. What is going to happen to me? Of course, some of these medications are new. And definitely some of the side effects are explored throughout the clinical trial. But I can assure you that before clinical trial is implemented, it has to go to extensive UK and European Union regulations. And also they need to comply with something called the International Conference of Harmonizations and the Good Clinical Practice Principles, which are extremely safeguarding in place in order to keep the clinical trial safe. Also, another major concern is my treatment is going to be affected by participating on the clinical trial if I say no, and it's categorically no. You're not going to be punished for deciding not to participate in a clinical trial, but you need to consider why we are offering you the clinical trial, because it might be that it's like a treatment that is not available on the NHS. Or it might take maybe 6 or 8 months to get the funding for it. So it's about balancing and communication between all the members of the team, including you. And also, if you decide to participate in a clinical trial, and it is not what you expect, it goes like unwanted side effects. You don't feel that there is enough communication, or suddenly the travel journeys to the hospital become unmanageable. You have the right to withdraw at any time without giving any explanation. So that gives you total power about deciding what is the best care for you. And now I'm going to give you like a brief overview of the clinical trials that we run in the Neuroendocrine unit. I'm not going to go through all the eligibility criteria. This is a study called Telestar, which is the new kid on the block. It's a new medication with the potential of reducing the levels of 24-hour urine, which may translate in the reduction of the carcinoid syndrome, especially diarrhea. For this particular trial, patients who are having at least 4 episodes of diarrhea a day, they might be eligible for this study. So if you are, it's something that we can discuss if you feel like it later on. Then the telecast is from the same company using the same compound, and it's for patients who also suffer from diarrhea, but they have less than 4 episodes a day on average. So in order to help them also reducing even further, despite having maximum amounts of sandostatin LAR or lanreotide autogel. Then if a patient is naive to treatment, so he hasn't had any treatments at all, or including somatostatin analogs, they are also eligible for this study in order to use this new compound as the first line of treatment, to see how it reduces the levels of 24-hour urine for 5-HIA, and to see how also reduces the levels of your symptoms. The NET study it's a really ambitious study, which is comparing lutetium-177 dotatate, which is radio-targeted therapy, with higher doses of sandostatin LAR. The normal doses of sandostatin LAR is 30 milligrams every 4 weeks. Some of you might be having 30 milligrams free weekly, and some others, apart from the free weekly, is also having boosters of these short-acting injections. For this study, it's actually evaluating whether 60 milligrams of sandostatin LAR is actually enough to maintain stability of the condition for longer, comparing this data with the effectiveness of lutetium-177. Yes. The Clarinet study is it wants to assess the value of circulating tumor cells in assessing the symptomatic response and the time to progressions in mid-gut neuroendocrine tumors who are going to be started on lanreotide autogel. So this study in particular, it is not a treatment trial, because you're going to be started on somatostatin analogs at some point in the course of your condition. But if you allow us to participate to give us your data for this trial, we can also measure something that at the moment it is not a marker, and it has the potential to predict how your disease is going to go without a CT scan, which is the circulating tumor cells. So at the moment, it's a really brand new marker, and it is needed much more research in order to be established as one marker that we might be able to use, as for example the chromogranin or the 24-hour urine that I'm sure that you are familiar with. Then the LUNA study is for, most of the studies tend to be for mid-gut and pancreatic, and this one is including lung and thymic neuroendocrine tumors who have progressive disease at baseline. And they are given another somatostatin analog called pasireotide or everolimus, which is a molecular targeted agent, or the combination of both, in order to assess the safety, tolerability, and the stability of the tumors. And then also another study which might not have benefits to you directly, but it might allow us to discover a new agent in order to localize tumors much more accurate and efficiently, which is the FETONET study, which is using a complete new molecule, which is 18M-fluoroethyl-triazole. I'm not going to repeat that. It's just 1 day study where a lot of assessments are done, having like a similar to an octoscan, but using this new molecule in order to assess if it actually adds anything in visualizing and localizing neuroendocrine tumors around the body. So to conclude, most of the clinical trials are for symptom control, stability of the condition, or developing new diagnostic techniques. But the take-home message that I would like you to have is about your involvement. It is not just about participation. You could have a say, an important say, on how the industry, the government decides what is the research that is needed. And that's something that I cannot repeat enough. You can do that if you are as a whole from the groups. So this is one of the most important messages that I wanted to tell you. And if you want further information, I will put all the slides in the website. But you can contact me by phone or email about if you want to participate, or if you want more information, or how you can get involved in all that we have discussed today. You have the website for the National Institute of Health Research program called Involve, and also you could see all the clinical trials that they are now up and running, not just for neuroendocrine, on these 2 websites from the Clinical Trials Governance. You could also check that information from the Net Patient Foundation, as Maya said before. You could also check the European Neuroendocrine Tumor Society for this information, or our website, which is in the process of being fully up to date. So I just want to thank you very much all for being here.